Today's lecture is on diagnostic coding. And these are the reasons for diagnosis codes. They're known as the International Classification of Diseases, the ICD. The description of the presenting problem is labeled the chief complaint, all right? And the physician establishes the diagnosis. You come in and say, my ear hurts, it's just throbbing and red and sore, and the physician diagnoses you as having an ear infection. So this is a diagnostic code. It is assigned for payment. The one reason for diagnostic codes, the big reason is for payment from insurance companies. Now, the ICD codes are maintained by the World Health Organization of the United Nations, by WHO. And the ICD coding system was established to track morbidity, disease, and mortality, death statistics. We can look at those codes and say, people in South Alabama, a lot of people are going in with this specific rash. Oh, it's Lyme's disease. So now we have the Lyme's disease outbreak in South Alabama. So that's what we look at with these codes, besides being paid for them. So right now we're in the ICD-10 CM code group. It's the International Classification of Diseases, 10th revision, current modification, ICD-10 CM. All right, there it is, ICD-10 information. In the ICD-10 CM, now we're not doing a comparison with ICD-9 because ICD-9 is no longer being used in any way, shape, or form. So we're going to skip over ICD-9 information. But the ICD-10 information is set up in the big binder that your instructor will show you. It's a great big spiral binder. It's an alphabetic index and a tabular index. So in the front of the binder is the alphabetic index. You can look up any disease or disorder by name. Fractured hip, ear infection, all right, routine obstetric visit. These are in the alphabetic index. The tabular index are where the codes are found, and they're done by body system, all right? And these are done with characters and specificity. The more specific you can get with the diagnosis, the higher the pay is going to be from the insurance company. Now, the categories are known as a rubric of 3 characters. All codes have at least 3 characters. The first character is a letter. The next 2 characters are numbers. Always remember this. Then we can have subcategories with 3 or 4 more numbers and characters, and our final code can be no more than 7 characters, combination of letters and numbers. But the first 3 parts of any ICD-10 CM diagnostic code are a letter and 2 numbers. We have placeholders. So if we need to have a 7-character code and we don't have 7 parts to the code, we use an X. It's called the placeholder. We have combination codes. It used to be you would diagnose strep throat as one code and streptococcus A as the causative factor. Now they have a combination code that says sore throat or pharyngitis due to streptococcal A infection. That's a combination code. We have conventions known as basic guidelines, and in the beginning of every chapter in the ICD-10 code book, there are basic guidelines to tell you how to code. Again, the alphabetic index is a starting point for coding. You never, ever, ever code from the alphabetic index, but that's where you start. And you're going to see cross-references that say C or C also, because it may be listed a different way. The tabular list is 21 chapters of disease descriptions and codes based on the body system or the condition. All right? There are additional guidelines for ICD-10 coding, which you will find in those specific chapter guidelines. How about coding unclear diagnoses? One of the coolest things about coding is if there isn't a diagnosis, you can code symptoms. So if you go into the doctor's office and you have lower right quadrant abdominal pain, but we can't give a diagnosis yet, then the office visit will say lower right abdominal pain. Once we do an ultrasound and we do some chemistries and a CBC and we realize it's appendicitis, then for the next visit or for the surgical procedure, we can code appendicitis. But we can code symptoms if no diagnosis is there. Principal versus primary diagnosis. You can have principal diagnoses, and we'll see what your book calls these because I don't want to give you the wrong information. I can have principal diagnosis of hypertension. All right, so I have hypertension. But if I go into the doctor's office visit for ear infection or an upper respiratory infection, a sinus infection, then the primary diagnosis is always going to be listed first. Why am I here? So when I'm teaching coding to my students, ICD-10 codes answer the question, why am I here? What brought me in? What hurts? Why am I here? And that's your primary diagnosis. Now, when I go into my docs, they put the primary diagnosis, sinus infection. And then the principal diagnosis may be that I also have hypertension. All right. I may have a secondary diagnosis to go. I may come in with sinus infection and then lung congestion. That would be a secondary diagnosis. We use diagnosis-related groups and IP coding for inpatient coding only. They're different than outpatient coding. Now, our health status codes are Z codes. So anything routine has a Z code. And this is where you're basically healthy. One of my favorite Z codes is Z00.0. This is for a routine physical with no other findings. All right. We have external cause codes, and these are the V, W, X, and Y codes. So if you broke your knee because you fell off your skateboard, then you're going to have a VW or XY code. And ignore the ICD-10, please, ICD-9, please. So here are your chapter codes, all right? Chapter 1, I call this the alphabet of diagnostic coding, and all my students have to learn the alphabet. The A chapter is 4, the D chapter is 4, the K chapter is 4. So chapter 1 is certain infectious and parasitic diseases, the A and B chapters. So for pharyngitis with a streptococcal A infection, we would find that in chapter 1. Now, chapter 2 is neoplasms. These are the C and D codes. And neoplasms are abnormal tissue growth. Don't confuse neoplasms with cancer. They are not. You can have an abnormal tissue growth as a neoplasm. The C codes in the ICD-10 book are cancer codes, are malignant codes. The D codes are benign codes. And that's something I teach my students when they first start with me. Chapter 3 is again, D codes, and these include, along with these other codes, diseases of blood and blood-forming organs, and certain disorders involving the immune system. So the neoplasms are D1 through 49, and the chapter 3 is D50 through D89. Chapter 4 is endocrine, nutritional, and metabolic diseases, the E codes. Chapter 5 is mental and behavioral health disorders, such as anxiety and depression. Those are the F codes. Chapter 6 is diseases of the nervous system, the G codes, and this could be cerebral palsy or Parkinson's. Chapter 7 is diseases of the eye and the adnexa. What is the adnexa? The adnexa are the structures around the eyeball. Chapter 8 are diseases of the ear and the mastoid process, because the mastoid process houses the ear, the hearing parts of the ear. Chapter 9 are diseases of the circulatory system. These are the I codes. So this would be for hypertension. Chapter 10 are diseases of the respiratory system, the J codes, and this is where you would have an upper respiratory infection or a sore throat. Chapter 11 are diseases of the digestive system, the K codes for Crohn's disease. Chapter 12 are diseases of skin and subcutaneous tissue, the L codes, maybe for psoriasis or eczema. And you'll see cancer codes in the body system codes as well. Chapter 13 are diseases of the musculoskeletal system and connective tissue. This could be a problem with musculodystrophy. Chapter 14 are diseases of the genitourinary system. They speak for themselves. Chapter 15 are pregnancy, childbirth, and the puerperium, and this is the period just before childbirth and 6 weeks after. So we always say that the chapter O codes are the obstetric codes. And chapter 16 are certain conditions originating in the perinatal period or the P period after birth. Chapter 17 are congenital malformations, deformations, and chromosomal abnormalities. And one of the most common chromosomal abnormalities we know of is Down syndrome. Chapter 18 are signs, symptoms, and abnormal clinical and laboratory findings, or the R codes. We call these laboratory codes. Chapter 19 is injury, poisoning, and certain other consequences of external causes. These are the ST codes. So an injury code could be you fell and broke your bones. So we're going to find an S code for you. Now, the one thing I tell all my students are that the S codes require 7 characters. S and T codes always require 7 characters. no matter what. Chapter 20 are external causes of morbidity. These are the V and Y codes. And chapter 21 are factors influencing health status and contact with health services, like Z codes, routine physical, mental health services, routine OB visits, and health insurance physicals as well. So there is a quick overview of ICD-10 CM diagnostic codes.